right time on a Music Monday. And every month we bring you the Breeze Leadership Foundation show, the Leadership Advocacy Program. And my name is Duke Emmanuel, and it feels so good to be here. It feels like this is my first time in a while bringing this program to you. And we have a very interesting topic today. Yesterday was World Health Day, and I feel like it's important that we have these conversations around health. Um, and today we're going to talk about health, wealth, and societal well-being. My guest in the studio, we have Grace Ebor, who's a public health specialist, joining us. Thank you for joining us, Grace.
Thank you for having me.
We have Dr. Joseph Iwuchukwu, who's a dentist and a life coach. Dr. Joseph Iwuchukwu, thank you for joining us.
Thank you very much for having me.
We also have Dr. Egbe, who's joining us, a founder, medic, and let's discuss ORG. Yeah, is
Thank
that let's
you.
discuss organization?
Yes,
Oh, nice, I like it.
organization. Thank you for
Okay,
having me.
thank you for joining us. All right, so let me start with you, Dr. Egbe. Health, wealth, and societal well-being. When you saw this topic, what's the first thing that came to your mind?
Hmm. You know the saying that goes, health is wealth?
Yeah.
Yeah, so I was like, okay, once we have a healthy society, we definitely have a wealthy society.
Mm.
So it goes a long way to build the workforce, encourage the society, ensure that we have more economic development out there once we have a very healthy population.
No, nice. I like the ring of that. I think that a lot of times we just say health is wealth, and a lot of times people just say it because it rolls off the tongue well.
Yeah.
You know. Let me come to you, Dr. Joseph. The topic health, wealth, and societal well-being. What comes to mind when one says that to you?
Okay, thank you very much. Is it talking about health, wealth, societal well-being? First, living in a society where all interconnected, and if a society must grow, it has to be that the population is healthy, and as my colleague said, health being wealth. There are different forms of wealth. We have physical wealth, and that's where health comes in. There's other the financial and social wealth. So, physical wealth, that's where health comes in, and that builds up the workforce, that builds up the productivity of the people in the population, and overall makes the society a better place because the people are more productive. There is more productivity in the system, and there's growth.
Hmm. I'm interested in getting your take, Grace.
Oh.
What's the link? These three things: health, wealth, societal well-being.
Okay, so there's a very big link. And first, when I saw the topic, what came to my mind was the big word responsibility.
Mm.
So the link I want to look at is responsibility at different levels. So everybody wants to be alive. Everybody wants to be wealthy, and to be alive and wealthy, you need to take the responsibility of your health. And so, you in this context, I will look at different people with different responsibilities. You as an individual, you as a member of a family. So, first, because households are the primary producers of health. So, every time we talk about health, people begin to think about maybe hospital, and they will say, the clinic is not functioning, the health center is not good. But so the link is the keyword and responsibility. So as you take your business serious, as you take your studies serious, as you take whatever you are doing serious, you are responsible for your health, first as an individual, and second as a household member, then thirdly as a member of a community. So whatever community you belong to, whatever you do is going to affect another person health wise. And then the last thing I will look at health is um, for the policy maker. And what's your responsibility as a policy maker as it concerns the health of the society? That's the link. If everybody take that keyword responsibility and look up what he or she is supposed to be doing at every point in time, then we'll be able to achieve those three keywords.
I like to bring up that, and I'll come back to you, on that big word, responsibility. But let me come to you, Doctor Egbe. You said
Mm,
health is wealth,
yeah.
and as I said, it just rolls off the tongue, and people say that, a lot of times. But in the real sense of it,
Okay.
is health wealth? Because there's some people that are healthy,
Okay.
but they don't have wealth.
Okay. Let's look at it this way. Thank you for coming back. So it's a general saying, health is wealth, right? Where am I coming from? Like my colleague said when he spoke, once we have a healthy population, there's something we use in occupational health. You're able to be more productive. Your output, the workforce, is larger. And then they are able to, you wouldn't be seated here if you weren't fine or healthy. I don't know if you get my point. So the whole
Mm,
idea is people having healthy lives
mm,
and also willing or workers going about their duties and ensuring that there's economic development
mm,
generally in the
mm,
society. So that is where the wealth comes about. So
mm.
if you're healthy and you're being lazy, then you're not productive. But
I
the
like it.
whole idea.
I like it. Dr. Joseph, let me ask you now, which is the question I should have started with. How do I know that I'm healthy?
Okay, thank you very much. I
Nice
love
one.
the definition by World Health Organization that defines health as the state of physical, mental, and social well-being, not merely absence of infirmity or sickness. So, when how you know you're healthy, I will first look physically. Are you whole? Do you have infirmity, sickness, or whatever? If that's not there, we also check your mental state because in our generation we have a lot of people walking about with mental health issues,
Mm,
right? And then it would also show in your social interaction. You have a healthy social interaction.
Mm.
So you'll check your physical state, your mental state, and then your social interaction.
mm,
And these things, when they are checked, which means you're healthy.
mm. Is it like a 1/3, a 2/3?
Exactly.
Or it has to
It
be a 3/3?
has to be
No,
a
it has to
favor.
be a three over
It
three.
has to be a 3/3.
Yeah,
Oh, interesting. So that means you have a lot of not well people.
of course.
Which brings me back to you, Grace. Now, you spoke about responsibility, and then
Yeah.
I like the fact that you broke it down because when you were talking, in my head, I'm like, is it an individual's duty to ensure that is fine? Then you said there's the individualistic angle, there's the family, and then there's society. Whose responsibility is it really to ensure that we have I mean, looking at the topic,
Yeah,
a society that
it's
is
healthy,
well?
wealthy, and okay. So yeah, it will bring us back to the first question you asked. What is the linkage
Yeah.
the health and wealth? And then he brought up the WHO definition. And so sorry, I'm not a clinician. I'm a public health person. So I'll be speaking
Mm,
from that angle. So
yeah.
that's why there's no perfect definition of health. You can't find a 3/3 out there. That's why you also ask that question. So if people are healthy, why are healthy people not wealthy, for instance?
Good.
And what was in my head was like, can you just take the COVID pandemic, for instance? That's a typical example. Or even though we did
Good.
not have COVID,
Mm,
some people in Nigeria, most people in Nigeria didn't have COVID. But did things move? Because some other society is sick, is affected all of us. That's the question
yeah.
you are asking.
Yeah.
Who is responsible? All of us. Is a collective effort. So you cannot have a 3/3. It's difficult to have a 3/3. So what we desire is some levels of functioning that you can function and support yourself, support your family, and support the community. Then we begin to know that in a layman's language, this person is doing okay. So before we talk about going to hospital to check whether the temperature is high or not. So that responsibility of who keeps us healthy or keeps you healthy Is your responsibility, is the responsibility of the person next to you, and is the responsibility of even people that are far off. And for instance, that's why climate change impact is affecting all of us. Whatever the highly industrial nations are doing and depleting carbon is affecting people in your village that don't even have cars, are not burning fossil, for instance. So it's everybody's responsibility because we are interconnected through the environment. So the environment we live in, whatever we put in it, comes back to us. So we are all responsible for our health and well-being.
For those who just joined us right now, Leadership Advocacy Program brought to you by the Bridge Leadership Foundation. We have our guest in the studio, Grace Ibo, a public health specialist, Dr. Wuchuku, who's in the studio, life coach and a dentist, and of course Dr. Ibe, who's a medical, who's founder of Medical Let's Discuss organization. Now we're talking about health, wealth, and societal well-being, and moving from what you said now, because we're talking about responsibility now. Let me come to you, Dr. Igbe. Now, um, so so I'm just in my corner, yeah.
Okay.
I'm just one young man that is not looking for trouble, but COVID comes into my society and it affects me, affects the whole economy, affects everybody. How how is that my responsibility to protect myself from this thing?
Okay.
Is it, is there no higher, you know, body that's supposed to?
Okay, when we're talking about, when we're talking about that responsibility, like Madam Grace said,
Hmm.
it has to do with you, the individual. Yes, the government has a role to play. Yes, the
I was looking for
community,
that word,
the
government. Thank
community
you.
has a role to play. And like she said earlier on, everybody is, it's a collective effort.
Mm.
So COVID comes into your society. Um, there should be adequate health education and awareness about what we're facing. And the community should also ensure that, okay, their people are duly informed and are carrying out certain health measures, preventive measures to ensure that this doesn't go. And you, as an individual, you have a very great role to play when they say, okay, you have to wear face masks, you have to sanitize, you have to do this, those basic health habits that we share out and ensure and tell people to carry out. It's your primary responsibility to ensure that you do these things. Look at waste management, for example. They tell people it's not good for to have open dumping, throw your waste very well, and all of that. All those things are things the government should put in place, rules and regulations that should be put in place so that people can follow. And you, as an individual, because like she said, whatever is happening in the developed country, we're a developing nation, is affecting us because people are not being held responsible and individuals are not acting responsibly. You go to the north, you see a lot of several illnesses because of open dumping that we've tried to, things that are not even common here in the south. Those are examples, for instance. So the individual plays a great role. So you coming from your example you've mentioned earlier, you as an individual, you just have to play your part. Because once you play your part, you're already on the defense line to ensuring that you're fine and you're healthy, even in that pandemic.
Okay. Dr. Iwuchukwu, from what Dr. Ibe has said, it feels like there is that link, the government, the communities, the people,
Yeah.
right? So at any point that there's a break in that link, it's like a football team. You have the midfield, you have the defense, and then you have the attack. If there's a break, there's a problem. Do we agree with
We
that?
do.
Yeah,
We do.
So how do we ensure that there's that smooth, everyone's playing their part perfectly? Because what I see about unhealthy societies from coming from the context of that we have is that there's a break somewhere. Somebody is not taking responsibility, and the minute there's that break, there's yawa. So how do we ensure that this link, stays um, and we keep going? Because it feels like when we have this link and this link is connected properly, we have health, wealth, and societal well-being.
Okay. Now, about the link, you see, everyone here plays a role: the individual, the community, immediate community, and the government. And as we've agreed together, everyone is important. Well, no, to our listeners, I'll start with the individual because I'm an advocate as a coach. I'm an advocate of personal responsibility, right? A lot rises and falls on the individuals. We would
But I
not.
thought advice and falls on leadership.
Don't worry,
Mm.
we're coming to that. And that's why
We'll
I'm an
come there.
advocate of personal
Okay,
leadership.
I get
Okay, so the first thing is to be able to do the things that are um, in your hands to do. You see, prevention remains the cheapest form of healthcare. And so when the individual, there are things you're supposed to do, um, healthy habits, healthy eating, um, all the hygiene and the basic things, doing that because if you get sick, this is the funny thing, and I think Madam Grace mentioned, getting sick is not just about hurting yourself or reducing productivity of society due to loss of man hours. You're also maybe if it's something infectious, you're already you're at risk of infecting someone else. So the individual takes the responsibility of his stuff, and then the community. And I think one link that is common to this, which everyone should pay attention to for a healthy society, is the matter of education,
it.
health education. Now, as much as it's government's responsibility to promote awareness of health issues, individuals, corporations, families should also prioritize health education. You know, learning about their health and informing others. So, the government should do their part, promote health programs, health awareness programs, and then the individual should intentionally seek to learn. The communities the family as the basic community should promote health education, seek to learn, seek to inform one another. All right. Thank you very much.
Thank you very much, Dr. Iwuchukwu. Let me come to you, Madam Grace, now. Now, Dr. Iwuchukwu has basically said something that's very key. The cheapest way to treat or handle any health emergency or whatever is to prevent it, right? Now,
Yeah.
what we're basically doing with this round of questioning is to find out the different roles and responsibilities.
Possibilities.
Yeah,
Okay.
as
Absolutely.
you started, earlier on. So, what are the roles? Government, community,
Okay.
people.
Exactly. Okay. So one of the key things that needs to happen for us to have a healthy society is what we are doing right now. So, first, I'd like to commend the Bridge leadership for this kind of program. So, we are already in it, right? So, like Dr. Iwuchukwu said, the best form of dealing with this issue is prevention. So, I will link my roles across the prevention areas. So
Okay.
it will be good for our audience to understand the different levels of prevention. So we have things like the first that's the primary prevention. So before even the something happens, the outbreak happens, what are we doing to prevent? So at each level, even individuals, governments, and the community have something to do. So when we are looking at primary prevention, like education, for instance, you will hear primary healthcare agency going to communities to do community outreaches. That's what government is doing. First thing government will even do is policy. So there's primary healthcare policy, there's child health policy, different kinds of health policies to just make sure that people have guidance, and people who are to do different things are able to do, including your health insurance and policy. So the government begin to put things like vaccines in place, still under primary prevention, to make sure that we don't even get to the hospital. So when government have done policy on vaccines and have provided vaccines, and then you people do village meeting and say that the vaccine is a way of reducing population You see how you are not helping. Yes, so for instance, now we are beginning to cry about human papilloma virus
Yeah.
that is causing cervical
Cancer.
cancer. We are telling mothers, if your daughter is 10 years to 14 years, there is a vaccine, the HPV vaccine. Government has provided it. UNICEF has provided it so that children between 9 and 14 years, that girls can get the vaccine and will never have to think about cancer. So they cannot provide the vaccine and come and force your daughter to get it. So as an individual, your duty as a mother is to ask yourself, this my daughter that is 9 years old, 10 to 14, where can I get the HPV vaccine to prevent cervical cancer? That is a rule. So a parent take that responsibility to take the child to be vaccinated, or present the child to the healthcare workers when they come around the neighborhood. That's supporting the whole effort. And then when once you take that vaccine, that child is free from cervical cancer all her life. So she won't have to deal with that in future. So we come to secondary prevention. Okay, when this disease is on ground, you now get to the hospital. So how do I even get to the hospital? Government have provided insurance, so it will reduce out of pocket expenses, because
Yeah.
one of the things that's making people not to go to the health center is the cost of health services from your pocket. So we end up in the chemist. We collect black and red capsule, yellow and black one, anyone, they mix it for us. And then we continue to become sick, and other things in the bodies get affected. So it is your responsibility to seek quality health care, not to rush to the chemist because you don't have the money. The government will not come and do that for you. So if you are able to understand what health insurance, which helps you to do risk pooling, you pay small but other people support, you should be able to do that. That is your responsibility. The systems are already existing. So we have health insurance at national level, at state level, at your job level. It's even in your community. That's how you see all the people and stakeholders we have mentioned. They will keep coming up. And so the third one, tertiary prevention, like people with bad conditions, let me use that word, forgive me, like people that need therapy, and we need to give them, even though maybe you have, let's say you have a stroke, and yes, you need a physiotherapy, we need to keep taking care of you, or you have terminal illness, and people living with AIDS, for instance. It's not only government that will come, so the whole community. If you stop stigma, for instance, stigma against people living with HIV and AIDS, you have done something noble to promote health. And then if you are able to tell your family member that is living with HIV, for instance, to go get the drugs and adhere to treatment, you have saved a life. So those are the different roles we can play as individuals, as stakeholders, governments, and community.
Interesting. Let me come back to you, Dr. Ibe. Now, of course, when Dr. Iwuchukwu was talking about health, and I asked how can I know that I'm healthy, we listed three major areas, right?
Yeah.
Physical, mental, and social.
Yeah.
Now, primary concern and how it affects us from this part of the world is what we see that we react to. So you have to see that someone is sick.
Okay.
Maybe you know you have 3 years, but it's basically the physical that we look at, right? So how and we've come to agree that these three um um these three parts are very very important. Yeah. So there's physical, there's mental, and social. How what I want to ask now? How do we um so I can get up. I'm physically strong, but I don't know if I'm mentally well or
Well,
socially okay. How do I find out? Let's focus on these two parts
these two parts.
briefly.
Okay, thank you very much for that question. Okay, looking at health in this these three perspectives. it's easy to have people look at the physical aspect, like you said, but we forget that the mental aspect and the social well-being is a major part of health. Now, you might not definitely have the three ongoing, like Madam Grace said, but either one of them could be a major issue for your productivity. And concerning the mental well-being, it's a whole lot of things. Nigeria happening to a lot of people by certain leadership deficiencies,
Decisions,
policies that are not in place.
Mm.
Because I like the way she did the explanation of the primary, secondary, and all of that. And she connected from the government, the community, and the individual. Because something I like about primary healthcare definition, which is it has to do with individual participation. So once the people are not involved, they are out of place. Now, talking about the mental well-being, it's a whole lot. If certain policies are not in place, let me start from the government to ensure good health and productivity. There's no economic development, which should boils down to the health of the people. There's a lot of financial crisis. The fact that your loved one might be sick can make another family member mentally unwell. Yes, because you're thinking of how to fund. And WHO encourages universal health coverage. And what we're doing is out of pocket payments everywhere, which is super expensive. So a person thinking of how to raise that money to cater for a relative that has cancer, for example, is not sustainable. Looking at the job opportunities that are there and income being generated, so that alone can cause mental
So that person that is
wellness.
physically sick will now survive, and this other person that is now taking on the mental.
And you're seeing a lot of suicide attempts coming up every day nowadays,
BP,
and
blood pressure.
there's a whole lot ongoing. So the mental aspect is actually very important because your state of mind would even affect how fast you even get well, because that's why most of the times if we have a patient in hospital, we even try to like a family physician will try to talk to you to ensure that you are out of that state, because whether you like it or not, we're treating you for high blood pressure. You go back home and you see the same problems, the blood pressure will come back up and our drugs will be useless to you. So that is an aspect. And then social well-being, it still boils down to the leadership, what we're seeing around everything ongoing. You go to even some job parastatals and everything, and then it's toxic environment ongoing in different places. So this awareness and education, like we're doing right now, it's what's very important to ensure that everybody is on that pedestal of being aware of, okay, this can happen to me here, this can happen to me in this area, and I should be able to be responsible for myself and avoid most of these things. And as well, the government can look into it and ensure that it's a safe environment for its people.
So I don't know the people that do all these researches, but I personally, now this is my personal opinion.
Okay.
I personally believe that it's come to the time where we will just declare that everyone who lives in Nigeria is mentally has to check their has to get their mental health checked. As far as you live in Nigeria, I don't know. It's just my
Oh my
thoughts.
god.
But
Yeah.
then I mean we have agreed that if someone is healthy,
Yeah.
right, they have the tendency to work, and
Yeah.
there's that link to economic development,
Development, yeah.
which is in turn can be
Increases
translated as
productivity.
this societal
Well-being.
well-being. So we're looking forward to a healthy society. But there's one key thing, and both of you have mentioned, Dr. Egbe and Grace, out of pocket expenses when it
Yeah.
comes to health. Dr. Iwuchukwu, um, what do you recommend? How do we fix this? Because uh, we just spoke about the mental part of it, and if you look at it properly, in some developed countries, people even pay more for mental therapy than physical, depending on what they what the problem is. But then if you have insurance, if insurance works, and there are all these things that can help, you know, with healthcare. It's probably going to get better from what I've heard. So how do we solve this out of pocket wahala?
Okay. Well, I'll look at it. I'll talk about this from two angles. The government and then the individual. Because if if the government doesn't deliver as we ought to, that is not a license for you to go and die. Right? So we expect that while we talk about what the government can do, I'll also mention what the individuals can do. Now we've talked about the health insurance schemes. I think these policies are already existing. There is the National Health Insurance Scheme, and then there are various insurance providers. And these policies are on ground. So we'll not talk about government raising policies. But I have a problem with the rate or the system of implementation.
Yeah.
Policy making is good,
Mm.
but policy implementation is better.
Mm.
We have very effective. Recently, I work at the University of Calabar Teaching Hospital, and recently we've seen cases where people who are members of these schemes come and then they can't access treatment because they go and then they say there's a problem. The provide service provider is owing the hospital and all those things, and so we cannot offer this treatment. And then people are now come. They came to the hospital with the hope of getting treatment because of the scheme they had enrolled in,
Mm.
but now they are now forced to pay out of pocket or go carry their infirmity and go until a later date when they may be able to afford the treatment.
Mm.
And so the government should pay attention to implementation of these policies that they've made. All right. And then for the individuals, there are individuals, as I said, these insurance schemes exist, but there are individuals who have refused, whether they are not, if they are not aware, at least listening to this, please be aware that such schemes exist. And then there are people who are aware, but for one reason or the other, they've refused to enroll. That's where, please, as individuals, these things are there to help you. It's more or less like where you're dropping something in a fund so that whenever things come up, funds are taken from what are pooled over the months, years, and can solve your health matters. So enroll in this, get an insurance. That's the thing, get an insurance scheme. Yeah, I think they're also private providers. So you could use a private provider or enroll if you're a government staff in government agency, even students. You see, I discovered, unfortunately, when I left school, I discovered that as a student or in a federal government institution, it was part of my school fees. I had access to free treatment,
Of course.
and I never used it.
Because when you go there, they'll give you paracetamol.
The thing was,
Yeah, try to use it.
I was not even aware. So for students who are
Every
possibly
time they give paracetamol. Every time they give paracetamol. I'm like, what's going on?
I know, and that's when because the government can do better, to ensure that
there
they
should be
deliver.
there should be some sort of subsidy, and I hope that the government officials are listening. There should be some sort of subsidy to ensure that we fix it. It's crazy. What's the life expectancy rate now in Nigeria? If I say it, I'll break people's hearts. So I'm not going to say it, but it's fine. Let me come to you, Madam Grace. Now, there's something that is very, very key, and we can't talk about the physical, especially as Nigerians, and we don't talk about spiritual. Is that is that a part of
A dimension. It's a dimension of health,
okay,
spiritual well-being.
spiritual well-being?
Yeah.
Yes, the WHO definition is not perfect,
Hmm.
so other additions have been made, and research is
By
a lot.
Of
So just when
By
you
Nigerians.
just check, not Nigerians,
A lot of other
absolutely it's
organizations.
global. Yes,
A lot of other
Yes.
organizations
other
are included.
organizations.
Yeah.
So yeah, because I've come to learn, especially in Nigeria, that the spiritual component, the
Mhm.
spiritual dimension of the definition of health is very key to especially Africans,
Hmm.
because it
Mhm.
affects all other dimensions. Yes, so many things that are supposed to give us stroke, high blood pressure, sometimes they don't even give us. That's what studies have shown. because of our participation and belief in the religious dimension of health. So what is giving people stroke in US? Here we will just do all night. You know that kind of thing. Yeah, we will just do all night and we bind and havash and cast. So,
Yeah.
but even as that is, it's also our problem, and because of that kind of faith and belief. So things that are physical, things that we can go to the hospital and take care of, we now not go. Like we'll go and deliver in the church, and the baby will
That
die.
is not my result.
It's
not my
it's
test
not my
result.
portion.
Yeah.
It's not like now when you now go to the Bible from Genesis to Revelation, everything that they are doing in the hospital is there, is recorded. Even how God asked the Israelites to prepare their camp, about sanitation, how to take care of the feces, how to take care, even up to the different types of healing, how Jesus did healing. Yeah, some miracles were explicit. You can place them, and some we could not explain them. They were like very spiritual. So some, Jesus was not a fool to use saliva, and he's not a fool to say go and wash yourself in the water, to show that you have to actually do something. Before Jesus came, the prophet that was asked to go and take a leaf from a tree to do one thing or the other is showing you the different ways God can do this. I really want our listeners to understand that there are times when we really need to get to our physician to get our problems solved. God has solved them already. There is no new miracle. The answer is waiting for you in the health facility. So we should not die because our pastor says we cannot take drugs, because our pastors take drugs. They go to the hospital, they visit the best physicians. Let us shine our eye, that kind of in this spiritual health, and read the Bible
In
very
other
well.
words, NG, what's it called? No grief for anybody.
No grief.
It's okay. All right, it's hit 95.9 FM, the leadership advocacy program. And we've hit when we're supposed to sign up. But let's see if we can take a few calls from our listeners. So if you've been listening to the program and you're itching to contribute, you want to be a part of the conversation. You have a contribution or a question, whatever it is. Let's see if we can take your calls right now. The number to call is 0700 959 44836. 0700 959 44836. We're talking health, wealth, societal well-being. Let's see if the phone lines can work for a bit, so you can send your contributions, and let's see if that can work real quick. We're gonna squeeze a few calls in. Thank you for joining me. What's your name? Hello, hello. Can you hear me? Oh, there we go. Try to call me again if that was you. Or if you're listening, try to call again. 0700 959 44836. That's the number to call. 0700 959 44836. Questions, contributions, whatever it is. Let's see who's here. Hello? Hello? Can you hear me? Oh, there we go. I don't know what's going on with the network providers, but I'll just try and hope that someone breaks the jinx. Let's see who's here. Hello? Hello? Oh, yeah. Can you hear me? What's your name? Yeah, yeah. Hi. What's your name? Edmond. Edmond, just go ahead.
Okay, I just want to thank the team and the organizer the British leadership for this wonderful show. Health is wealth, and the community let us know that you take your health seriously. It starts from you, not just depending on the government or depending on any other person. Let's take our health personal great care and it's a personal thing and take it seriously.
All right. Thank you very much, Edmond, for calling. It's important, and as they put it, it starts from us. So everyone has a part to play. Everyone has a role to play, and if we play our parts well, it would show in the societal well-being. That being said, we want to thank you, gentlemen and ladies,
Thank
for
you.
coming on the program. Thank you so much, Dr. Egbe, for sharing your thoughts with us. Thank you,
Thank you.
Dr. Iwuchukwu. Thank you, Madam Grace
Thank you very
Ivo, for
much.
being a part of the program.
Thank you very much.
And we will see you next month. All right. Obranya coming up next with Keeping Up.